he was head of school. And I said, Mr. Tingley, well, how many kids are going into medicine? And he goes, oh, Steve, these kids are too smart. They're going into finance.
So welcome to our Focus Through the Generations series. We're so glad that you joined us this evening. And I've known Dr. Siepser forever, it seems like. So it's really good to have my friend in front of me talking to him. So thank you for joining us.
It's great to be here. And as you know, I'm an ophthalmologist here in the Philadelphia suburbs and have been for 40 years. And I think I bring up the upper end of what happens to senior ophthalmologists. And I'm just having a great time now practicing just the way I want. We have a fairly big practice, but I only operate now. I only see pre and post-op surgical patients. And with sort of been around this long, I still see a lot of complex problems and weigh in on things that are quite interesting. Recently, I removed 2 of the Verisize implants. I think I put them in 20 years ago, and they were referred from elsewhere because no one wanted to touch them. And that predated the ICL, the Vision ICL from Star, which is behind the iris. It was an anterior chamber iris claw lens, which was quite a thrill, but worked beautifully for over 20 years for these patients.
Well, you did my array lens back in 2002.
Oh my gosh. I see that lens quite a bit. And you know that I still use the crystal lens, the B&L crystal lens. I had a great experience the other day. A patient came in and she looked a very, very astute lady, and she really spent a lot of time. And she came in, she said, Dr. Siepser, I want an Alcon Acrosoft lens. And I said, I don't really use those. How you want maybe the Panoptics or something multifocal, but I really have gotten away from those. And I use the only pseudo accommodating implant. It seems to work really well in my hands. I've done 4,000 of them. And she said, but listen, 80% of the doctors in the country use that lens, and over 82% of the lenses in this country are Alcon lenses. And I said to her, you ever play golf? She said, well, what do you mean talking about golf? I said, well, 80% of the golfers can't break 100. But I had a better analogy for her, really. I said, when I get to a meeting and everything, people sort of line up for the escalator, right? It's easier. It takes you up, but they're waiting for the escalator. I always walk up the stairs. There's no line there, and it's better for you.
I like it.
And so being an outlier most of my life, I want to assure you it continues.
I love it. I love it. Well, I still like my arrays, but I would like to upgrade. So maybe we can talk later.
Have to. I did 900 array implants.
My mom's 96, and she just started wearing readers only because she has macular degeneration.
Oh, yes.
But not for any other reason.
Yeah, that's amazing. I'm glad your mom's still trucking on.
Still kicking. Well, you just answered one of my questions. I wanted to ask well, maybe you have another one though. What is your most memorable patient or experience in your career? I'm sure you have many.
Oh, wow. That's a great one. One of my favorites, I wrote an article about her. This little old lady had really hadn't been to a doctor in years and years, or certainly not the eye doctor. She came in pretty advanced glaucoma, pretty bad cataracts. And I said, Mrs. Jones, I think I can get this all. I'm going to take care of this. I'll take out your cataract. I'll do endoocular cyclophotocoagulation. I'll put in an eye stent. I think I can get you really all better, and you won't have to use drops. And your vision, which is really quite poor from your glaucoma, also that progressive loss will be stopped. So I go ahead and I do both eyes. And like, she was just one of these charmers who came through, and she had pressures like 16 and 20, 25, 20, 30 vision, and felt really great. And so she's in seeing me, And I look at her and I go, wow, this is amazing, you know? Oh, but I don't want to break my arm patting myself on the back. She sits back and she says, Dr. Siepser, it's a sad dog that can't wag its own tail.
You tell her you are not a sad dog.
I don't have any trouble wagging my tail, but you know, she didn't know that.
Me either. And you know, I figure why not? If I'm the only one that does it, it's a good thing. But I love that story though. That's really cool. You do a lot of complex surgeries. I know that about you. And he's like you're like the guy that everybody sends the can't be done's to. Or
You
I've done
know,
it
it's
and
sort of interesting. I was just reviewing, read an article in Ocular Surgery News by this guy Agarwal from Chennai,
I know
and
Dr. Agarwal.
yeah, he's very, but you know, he's come up with this 4-pass sliding knot, and it always irks me because if McCannell hadn't before me hadn't said, well, you know, you can actually suture iris, and so back then we'd put a big cut in the eye and reach down, grab up the iris and tie it together and drop it down. And but that we didn't even realize you could suture the iris. And then I invented the Siepser sliding knot, where I actually externalize the tying of the knot using a fly tying method. So we do fly ties, you sort of slide the knot onto the fly, and that's sort of what precipitated my saying, oh, I'll just slide the knot into the eye. And so, of course, a bunch of ophthalmologists, it's the Osher knot, it's the Snyder knot, now I go, but most people are pretty kind. You know, they mention your name, or they say, you know, because we've all built on the shoulders of the predecessors, you know, and I wouldn't have come up with a sliding knot if Peter McCannell hadn't said, well, you can actually suture the iris. Because when I remember my senior partner back then, when I started suturing irises, because he did sector iridectomies, and I had hundreds of patients with sector iridectomies from the old intracap days. And I closed so many of those. In fact, the other day, I remember Mr. Geist, I actually found a slide of one of the first ones I ever did.
Wow.
So that's been a lot of fun, and getting patients from, you know, really all over the United States to come in to get iris repairs. And one of my favorites is from Alaska. He came down to see uh, Gary Condon in Pittsburgh, and Gary said, well, why don't you come see me? Siepser's right, you know, down the road. And so he's been a lot of fun, and taking care of these heretofore untreatable eyes has been very rewarding.
And that's been your career. And I think that's what you're known for. And I know you're known for the seats or not because sliding knot, because I've been with you too many times when I mention your name and they go, yeah, that's the Siepser sliding knot. I'm like, yes, that's the one. So I love that. But Dr. Irewald, that's okay. Because you know what? Biggest form of flattery is imitation, right? So, you know, if they want to imitate me, I'm okay with that, especially him. He's awesome. What do you think is the biggest problem, Dr. Siepser, facing the ophthalmic today, the ophthalmologist today, and the ophthalmic industry today, given where we are right now?
So, you know, it's interesting, Polly, since you haven't met Bob Curran, our new president.
Are we
Uh,
on?
you really have to meet him. But Bob, he was a pitcher for the Dodgers, and he came up with great poupon mustard and A1 steak. So this guy's a great fun, and I'm his retirement project, I think. But we're having the greatest time, and he divided our practice now. You know, properties. It's Siepser Properties, Siepser Technology, Siepser Eye Care, Siepser Laser Eye Care, Siepser's Dry Eye Center, and he's really like put the whole thing together. And I was thinking about that, and I said the problem I think in medicine is because we spend, you know, we're a very dedicated group. All doctors are. They have to spend every waking hour learning what they know, and they don't have time. I read one of my all-time favorites was The Wealth of Nations by Adam Smith. And when I read that book, I realized that the business interests, it's a different plane. It's just has nothing to do with medicine and what we do on a daily basis. And I think business has taken advantage of medicine because we are, you know, mission driven, moralistic, And, business folks, it's all about profit and amoral behavior, really, as I see it. And I have this now, president who's a really sharp business guy. He protects me, so I see what's facing the physicians is that we're terribly underpaid. I mean, it's awful. I was figuring out that in reality, we now are paid 5% in real dollars for a cataract surgery compared to 1984. Very simple. We got near $2,000 in 1984 and $1984. And with the $1984, you did 5 cases. You could buy a car.
Mhm.
Cars were, 3, 5,000, 8,000. Now cars are nice ones are 80,000. We're getting $500 for a cataract. Your profit margin, it must take us 200 cataracts to buy a car.
Mhm.
And it's a problem throughout medicine. And I always find one of my favorite thoughts is um, someone once said, I don't need politicians. I don't need actors and actresses. I don't need sports people. I don't need professional athletes. What I need is doctors, teachers, and nurses.
Mhm. That's a great quote.
And and I don't think I was reading how an article in the New York Times recently where they were saying that all these the heroes, the frontline folks in medicine, they didn't get raises. They're not valued for what they did. They give you a cupcake and they say, well, thanks for the, near death experience. It's just a a sense that we need to be business trained, which a lot of us are. I spent time at Wharton. It helped a little bit, but I really don't have interest when somebody puts a contract in front of me. I don't really care about that. I want to, where's the next patient? What's the next operation? And I read voraciously the amount of magazines, journals, and online information I gather in a week, um, and talking to colleagues. And I mean, it's exciting and fun what I do. I just like to be paid a little better. That's all.
Yeah. Well, I think that is the biggest, to me, I think the biggest challenge facing right now is profit versus overhead or
So
overhead.
that's one of my favorite stories. So my girls went to Andover and Exeter, and I got friendly with Mr. Tingley at Exeter. Claire was a really good student there, and I said he was the head of school, and I said, Mr. Tingley, well, how many kids are going into medicine? And he goes, oh, Steve, these kids are too smart. They're going into finance.
And
So
it's true.
all the best minds are, not in medicine. I mean, there are a lot of brilliant people and wonderful people, but I mean, really, you sit down with some of the folks in finance and they have amazing minds, but they're gamblers.
But it's a fear. It's a fear that we're heading up on. You mentioned a book. So I know you read a lot. So what is your favorite book of late that you've read and why?
Well, of late, it was I still Malcolm Gladwell's David and Goliath was great fun. But I have a story about books. It's really interesting. So my kids aren't readers. They play games on the computer and everything. When I was in high school, I read like every significant book in the high school library. And Mr. Blaney, my history teacher, arranged for me to have a private library. And I remember reading "Go Tell It on the Mountain" by Farmer. All that I could order any book I wanted, and of course I plowed through. I was a voracious reader, and when you ask me, well, what's your most influential book? And there's so many, and I find each one fits into a piece. Those classics, and I want to make my kids read um, the books about interpersonal relations. The Emotional Intelligence, a great book. How to Raise an Adult by Haycom out there in Stanford. Really about how to have your children accept responsibilities of life early so they don't get to college wondering how to do their laundry and cook. And so the David and Goliath book I really enjoyed because I have these kids going to college, and I had Susanna spend some time with it also, because my older kids, here I am, 50-year-old, I want them to go to the best schools and send them to Exeter and Ann Arbor. They went to Reed and Smith, and they're barely employed now, and they have great lives. They're artists and very, very interesting people, but they don't bring in a paycheck. And so our kids have worked on the farm. They're not going to any fancy schools. We are going to send them to schools that are appropriate for their skills and their desires, mostly on smaller liberal arts experience.
Mhm.
And Ben, I'm trying to get him to try a trade. I mean, he make a great electrician. I mean, this college thing. So I just have a different perspective as an older parent, and I'm not into, well, my kid went to wherever, and I'm certainly not going to pay some guy to get them into some place where they don't really belong.
And that's where wisdom is so key, right?
Oh, I
Wisdom
don't know if it's wisdom
thing.
or experience, but
A little
they
bit,
say
maybe.
a smart man learns from his mistakes, and a wise man learns from other people's mistakes.
My computer.
I think I'm only smart.
I disagree. I disagree. Well, I'm going to get down to our final question because I don't want to take any more of your family time, but I love talking to you. I could sit here and do this all night. You know that. Um, I have one question that we're asking every person that we interview, and that is, how have you seen technology in ophthalmology transition since your career started? And what technology do you foresee in the realm of the future coming into our industry that may forever change our industry?
Well, the big one is artificial intelligence. It's amazing how often I'll just go on Dr. Google, because the patients already have been on Dr. Google when they come in. So I think it's going to be in the information side, the analytical triage, the equipment, of course, will be light years ahead of what we've done. When I started doing, don't forget, I was a surgeon trained in intracapsular cataractic surgery. I mean, think about it. And when Charles Kelman was a friend of mine and actually very influential in my life. Charles, when I was graduating college, I had been a ski racer and on the lacrosse team, and I'd had a really good time. And then the Vietnam War was on, and everybody wanted to go to medical school, and I just didn't have the grade point average. I got into Hannum and a couple other places, but always waitlist, enough to get deferred. So through a friend, I called Dr. Kelman, and he said, well, don't worry, I went to school in Lausanne. I'll get you in there. And so on my way to Lausanne, I actually stopped in Belgium at a school there. And it was Louvain, which was considered the Harvard of Northern Europe. And I mean, it was tough, but I had a great experience. And then, of course, when I came back and after I tried pediatrics, didn't like that, and discovered ophthalmology, which was using my hands. And I had been a electron microscopist in college. I worked my way through college and medical school doing electron microscopy. So I was always using one of these AO bio microscopes. So when the microscope hit ophthalmology in the late 70s, I was set. And so these technical things are important, and they definitely change the way we practice. But if I had to have like one piece of equipment right now, I think I'd keep my VisX excimer laser, because it's the one thing that really supports the practice and all the fun we have, because it actually makes money for us. And that's a little unique in medicine today.
Make money, yes.
So going forward, these devices are going to be more integrated and more talking to one another, more independent of physician, and also reminding us. That's why being a senior ophthalmologist now is so easy, because you've got Google, and you just need a piece of what you're thinking. And if you're disciplined, you go back and say, what other things could this be, and where else could this be? And I mean, I just had a patient come in with and non-arteritic optic neuritis, in 2 seconds I could show them the picture. Look, it's a superior altitudinal effect. We probably, this rarely will be a tumor, but we're going to send you down to a neuro-ophthalmologist, and that assist from the knowledge base that exists at your fingertips is an enormous. I mean, in the old days, I'd have to go look in a book or even try to remember something. You don't have to do any of that now. Just a few keystrokes and off you go.
That's true. That's very true. Dr. Siepser, thank you so much for joining us this evening. And I'm so happy to get to talk to you and be the one to interview you. That makes me very proud.
It is a special moment, and thank you for having me.
You're amazing. Thank you.
Right.
Good
Good
night.
night.